Good morning. I'm Ann Schindler, and this is First Coast Connect. Today, it's a preventable infection, but one that untreated is the leading cause of infant mortality. We talked to two experts about why congenital syphilis rates are spiking, especially on the First Coast. Later in the program, exactly what is a retro Afro futurist cellist? Stick around and you'll meet one. But first, the number of babies infected with syphilis has increased tenfold over the last decade, and the problem in Duval County is among the worst in the nation. Here to tell us why and what needs to be done is Dr. Chandra Adams, an obstetrician gynecologist at Full Circle Women's Health. Good morning, Dr. Adams. Welcome back.
Good morning. Thanks for having me.
We're also joined by Dr. Mobeen Rathore, Associate Chair of the Department of Pediatrics at the University of Florida College of Medicine-Jacksonville and Chief of Infectious Diseases and Immunology at Wolfson Children's Hospital. Good morning, Dr. Rathore.
Good morning. Thank you.
So, Dr. Rathore, let's just sort of start with the basics. What is congenital syphilis and how do newborns get it?
So congenital syphilis, is, as the name suggests, is an infection known as syphilis caused by an organism called Treponema pallidum. And it is an infection that occurs in the mothers. And during pregnancy, the mothers can transmit this infection to the babies, like many other infections they can do, HIV, hepatitis B, and others. So this particular one is where when the babies get this infection during pregnancy, they can have some serious outcomes, serious signs and symptoms, sometimes at birth, but usually at birth, the babies may just look normal.
And women who have a syphilis infection are quite likely to pass this to their newborn if they're not treated. Is that right?
Yes, if they are not treated, the possibility of infection in the baby is very high, and it's also very easily treated. I'm sure Dr. Chandra will Adams will talk about it, but it's an infection that we can really treat in the mothers, so the baby doesn't even experience that. But once the baby gets it, it could have serious side effects. It could have serious issues. But the most important thing is if we don't know that the mother is infected. So that's where testing for this is so critical.
Dr. Adams, testing is primarily done by people in your line of work, OBGYNs, right? You are the ones seeing the patients, and there are some requirements in Florida that you have to test at certain stages. Is that right?
Exactly. So it's actually part of the intake panel. So when you first come in, you have your initial prenatal panel, and that includes your blood type, your blood counts, whether you're anemic or not, and then some serologies. So we routinely test for hepatitis B and C. We also test for syphilis and HIV. And then we do urine cultures. But everything that we are testing for are things that have an impact on what happens in the pregnancy. So that's the routine panel recommended by the American College of Obstetricians. And then, of course, the state health programs also recommend testing at least once at the beginning of pregnancy. And then because sometimes, so anyone who is having unprotected sex obviously is at risk for acquiring a sexually transmitted infection during pregnancy, it is recommended to test again in the third trimester because we still have time to treat and impact these outcomes at birth.
There still can be a period, though, between that and birth where a woman contracts syphilis, her baby contracts syphilis. How does syphilis present in an infant?
So typically, as Dr. Rathore mentioned, you may not know at birth because the effects may be with the neurologic system. So they may not be evident until later when baby's not meeting certain markers or milestones that you're expecting to see. There could also be blindness. It can also cause loss of hearing. And so when we do have the hearing screen that newborns have to do within the first day or two of life, that could actually be one of the first clues.
So it's my understanding that, 40% of children, Dr. Rathore, who are born with syphilis may die the first year.
If not treated.
If not treated.
I think that's the very important thing. And as Dr. Adams mentioned, the baby just have sniffles. That's all they can have when they're born. And a lot of babies have sniffles. So I think that's why Dr. Adams mentioned HIV, and it's one of those things that with HIV, as you were talking before the show, is something we have been able to prevent in babies. In our program at UF Cares, we have not had an infected baby with HIV since 1998. So if we can do that for syphilis, for HIV, surely we can do for syphilis, for which we have a lot more information, lot easier treatment. I mean, it's if you know that the pregnant woman is infected, all you need is 3 shots.
I want to ask you, I mean, if it is remarkable, and your program deserves a lot of credit that there hasn't been a child born with AIDS since 1998. That is astonishing. But we know that when it comes to syphilis, that is not the case.
That
That the Duval leads Florida. It has far more than adjacent counties. It's, among the, top 20 in the
mhm.
nation when it comes to large cities with a problem. And so what is happening unique to Duval County?
So I think first is lack of access to prenatal care. Well, let me even step back. Lack access to care, because if you're a woman of childbearing age, and that's something you have proper care, proper access to medical care, your provider will be educating you that. And then when you get pregnant, you should have easy access to prenatal care. As I was alluded to earlier, that you have to test early in pregnancy or at your first visit, if you will, with the obstetrician. But it is also recommended in the state of Florida to test late in pregnancy. So, and if you have not been tested and you come for labor and delivery, hospitals in their labor and delivery units need to have protocols that if they cannot document and confirm, let me repeat that, document, not just verbal, document and confirm that the woman who's in labor and delivery has been tested for syphilis and is negative recently, late in pregnancy, not early in pregnancy, because remember, you could get infected in between early pregnancy and labor and delivery. They should be tested, because that test, even though the mother may not have been treated, we can still protect the baby from getting the infection. Or if the baby has gotten the infection, we can make sure we follow and make sure the baby is well. We have had situations where babies we have seen 3 months of age because the mother was missed and the baby had syphilis, and that's too little bit late, and we want to avoid that. So I think having protocols in place in your offices, and most obstetricians have that, and in the labor and delivery are important, but it's access to care. That's so key. We know all about syphilis and HIV, but if you don't have access to care, it's not going to be working very well, what our knowledge is.
I want to ask you, Dr. Adams, because sometimes there are patients that are, getting care, but then the testing occurs somewhere else, and that's sort of out of your control. Is there Are your patients, when they're getting tested, doing that initial screening panel that you were talking about? Is that something that happens off-site? You send them with some lab work and they go and get it done? And is that a problem?
Well, currently, yes, but we are about to bring all of our lab testing in-house to make sure that it gets done. Because sometimes you do have, busy moms and they're busy with other things and work, and they say, "Oh, I still haven't had a chance to get those labs done." But if you can capture them when they're there in the office, then you can make sure, hey, you're already here. Let's just take you in this other room, draw your labs really quickly, so that we can get this information and act on it sooner, because as Dr. Rathore said, the sooner you know, the better your outcomes are when you have a better chance to treat early.
I was really surprised to see the range of effects that can be passed to a child who is infected with congenital syphilis, not just stillbirths, which is a serious risk, but nerve problems, seizures, deformed bones and teeth
Mhm.
that can be very prone to breaking, enlarged livers and kidneys. Even some studies have suggested autism.
So, not sure about autism. So we'll put that aside for a minute because that's a different conversation. It is a systemic disease, meaning it can affect every part of the child's and the adult's body. Sometimes it takes a little while, but if you don't treat it, it will affect your nervous system, your eyes. You can have cataracts. You can have bony issues. In fact, they could be more prone to fractures. The bone gets weak. You can have hepatitis. I mean, it can have any part of your body can be impacted. You can have some bad rash. I mean, this is an infection. It was called the Great Mimicker in the past, where it could mimic almost anything.
Really?
Yeah, it's a so I think, and here's an infection, and this is a classic public health issue, an infection that you cannot obviously see early on. It's easily treatable and is inexpensive to treat. And if we are not able to prevent this from passing on to the baby, we have failed.
Mm.
The richest country in the world has failed. We have failed our women, we have failed our babies, and we have failed our nation. This is such a no-brainer. I mean, it's so inexpensive. I mean, for less than $100, you can treat the pregnant woman, and for $100, gosh, sometimes people go out and have a meal for $100.
Right. I want to ask you about the cost element of it because, one of the reasons we're discussing this today is because there was a item in the mayor's budget allocating funds for testing. And that line item, it's roughly $110,000 for infant mortality and syphilis screening. It's one of a number of health budget items that the city council has now put on a cut list, basically said that they intend to cut, they want to cut from the mayor's budget. Dr. Adams, does an allocation of $110,000 move the needle at all on a conversation like congenital syphilis?
So again, just because it's such an easy and inexpensive one to detect and treat, absolutely. It doesn't require a lot of money. But the people who are, boots on the ground doing the work, like Dr. Rathore in their mobile clinics, they're out testing people and they are treating people and writing these prescriptions and detecting early, that even that small amount of funding can make a huge difference because, we want to be number one in the nation in some things, hopefully football, go Jags, but we don't want to be number one in the nation in syphilis. And as you said, what's most alarming, I think, is that our numbers are rising. Whereas in Florida, the numbers, 22 to 23 or 21 to 22, the numbers actually dropped. But in Duval, they went up by 40%. So what are we doing different, even just from the other counties in Florida? And I think that that's something that the city council really has to pay attention to, is that we're leading the way in a very negative category.
In the wrong direction.
Mhm.
Yeah. If you're just joining us, we're talking to Dr. Mobeen Rathore and Dr. Chandra Adams about the problem of congenital syphilis. You can join our conversation. You can give us a call at 904-549-2937, or you can email First Coast Connect at WJCT.org with comments or questions. You can, of course, reach out on social media. So in terms of what we're doing differently, I mean, just by way of comparison, in 2 years ago, Duval County had 35 babies diagnosed with congenital syphilis, which is a large number. It's more than the entire state of Illinois in that same time frame. But meanwhile, Clay County had 2. St. John's and Nassau County had 0. And so we're not talking about a regional plague. We're not talking about a problem that is manifesting itself, throughout Northeast Florida, but it really is a problem here in Duval. What are some of the factors that contribute to that? And what do you think needs to be done to turn that around?
Well, first and foremost, I think I have to go back to what I said earlier. It's access to care. And if you don't have access to care, and this is still a huge issue in Duval. As we go out and test in the community, we have a lot of uninsured individuals for different infections, including syphilis, uh, who have difficulty accessing treatment. Now, HIV is not simpler, but access is simpler because we have resources. We have Ryan White. We just celebrated 35 years of the Ryan White legislation. So the Ryan White legislation has really helped access to HIV care. So anybody who has HIV infection should have no problem getting access to care. I can't say the same thing for syphilis. So when we identify somebody who has syphilis and they are uninsured, we face that dilemma. Where do we send them? How do we pay for their treatment? The health departments are supposed to do that, of course. But I think what the $110,000 should be a lot more than that, frankly, but it's a good start. And I think it has to be structured. There is availability of testing. We do free testing. Other people have free testing. Testing is not an issue. It's the issue of coordination and access to care once you are positive. So we know you're positive. What do you do next? If we can't treat them, so if you don't have access to them, we can treat them. So I think that's where it has to be, that we first off, we go out in the community, offer more testing. We need to make HIV, syphilis testing as a part of routine care.
I mean, the Department of Health is the agency that is sort of over community health like this. And I want to ask you where they are on this issue. I was just in preparing for today looking at some research data and was finding fairly up to date numbers at places like the CDC. When I was looking on the Department of Health website, their most recent syphilis data on a county by county basis was coming up as 2005. Um, and I perhaps they have more updated data somewhere on their site, but it certainly wasn't on the kind of initial search pages. Is that indicative of kind of where they are in terms of serving the community on this?
Well, the people who work in the health department are some of the most committed people to care for the most vulnerable. I worked with the health department for the last 34 years, more than 34 years. I'm in Jackson. I'm in awe of what they do. Unfortunately, our public health system has been decimated over the years. They don't have the resources, they don't have the personnel, and that's a responsibility of those people who are making those decisions for funding these. So, having said that, the health departments, yes, they are the people who do it. Not having that data on the website for everybody to see is, what they call an ostrich, right? You're trying to hide your head thinking it'll go away. It's not going to go away. And so I think we need to make sure, I always like to differentiate that the people on the front rows, front lines are working very hard. But, we had a case of tetanus recently. A child born and raised in the United States. Parents undocumented. With all what is going on, they were scared to take this child to get immunizations. How sad is that? I mean, think about it. This is a totally preventable. So, syphilis, same way. I think we should be, the health department should get the resources and, and we can work with them, coordinate. We have, the way we are able to test and many others are able to test is because of our grants, which are really federal grants that we have and contracts that we go and test. Health departments help. Don't misunderstand me. Even from Tallahassee, there's help. But a lot more needs to be done. We have to make public health first and foremost in all our funding for healthcare.
Doctor, go ahead.
Yes, and I was just going to add, on my side, obviously we're testing the mom and we're emphasizing prenatal care and congenital syphilis, but the moms aren't giving it to themselves. So then we say, hey, and your partner needs to be treated. And so then you have an uninsured partner who doesn't qualify for pregnancy Medicaid. She's covered for 9 or 10 months while she has pregnancy Medicaid. Then unfortunately she loses it at 6 weeks postpartum, but that's a different story. But in any case, she has pregnancy Medicaid, so she can go and pick up her treatment, bring it back to my office, and I can treat her. But then I'm saying, I can write the prescription out of necessity for your partner. There is a statute that covers emergency coverage of partners, but he's not my patient, so he can't come to my office and get it. So I'm sending him to the health department, hoping that he'll go, if he doesn't have his own primary care. And if he doesn't, well, now he's, the new patient zero, and he's still out there, and other women may be getting infected, or he may reinfect the partner that I've already treated.
What do we know about, habits or tendencies in sexual relationships? Are we seeing any measurable, decline in things like condom use? Do we know anything about how sex education is impacting people's choices in this adult portion of their life?
I have not seen very many changes. I've been probably doing this 25 years or so at this point, and human nature has not changed at all. I see people don't change; they become more like themselves, and everyone's thought is, but that's not about me. I've never ever diagnosed anyone with an STI who said, I knew I had that. Everyone's always surprised, it's out of the blue. How did I get this? And then you're going through well, I think you know how you got it, but you don't really want to tell them. And, there's all sorts of talks of toilet seats and that sort of thing. But no, it's your partner, and you need to have a conversation about your relationship. So I think it's good that people have, awareness with regard to how STIs are propagated, but it still doesn't change the fact that people still don't think that it's about them until their test is
I want to
positive.
pick on something Dr. Adams mentioned. We are talking about a lot of testing women, which who have, believe it or not, better access than men, and it is the men who are spreading it because the infection is more likely to be transmitted from a male to a female than vice versa. So I think if we are not able to partner identification and partner treatment is such a critical thing, and that's a key role that the health department has to play. So when we are required to report syphilis to the health department. When Dr. Adams or myself we report to the health department should then do a contact investigation. Who is the partner identification? We do it for measles. We do it for other infections. Why not this? And this is again, as Dr. Adams said, if you don't treat that male, well, first of all, that male is going to suffer in the long run, and males will have, by the time they have signs and symptoms, it can be really bad. But they can also continue to transmit it, and so they need to be treated. They are we as males, uh, the are really have to take responsibility, but we have to have resources to access and to be able to treat that, and it's easily treatable. That's what's the
It is easily treatable, and yet the only product approved and recommended to treat this particular STD during pregnancy has been experiencing a shortage. Can you tell us a little bit about what you're seeing, what this medicine is, and why it's in short supply?
So the treatment is penicillin. So there are various forms of penicillin, but bicillin, which is a long acting, so you have to get just one shot and it works for a month. That's the one that's short supply, and it's not the first time, unfortunately, and it's a part of many other medications that we have a short supply of in the United States. Bicillin is pennies, so I think there's not much
Money in it.
money in it for So, but even with the shortage, there has been a preference for treatment of syphilis by the CDC and others. So, fortunately, we are still able to have it and use it for pregnant women and for children. But yeah, that's a problem because you don't need shortage for a drug that is inexpensive and easily given, safe. We have known it for since 1944, and if you can get it, that's another problem. Again, it goes back to systems, and that's where it's the responsibility, I believe, of the government to make sure we have those things and easy access to those medications, which are such an important public health intervention.
And so this medicine has had some shortages and then recently was the subject of a recall because there was some contamination found in some of it. Are they prioritizing, Dr. Adams, patients who are pregnant and diagnosed with syphilis?
Absolutely, and rightly so, because again, the far-reaching consequences of not treating pregnant women. Also, you now end up with a child who has all these neurodevelopment issues that again continue to add to the cost of healthcare in whatever area where you see these numbers in these cases rising. So yes, the priority is treating pregnant women because you're treating two patients at once whenever you do that, and you're getting more bang for your bucks, so to speak, or for your pennies,
Yeah.
um,
Yeah.
so to speak, when you use this treatment.
This is, I mean, worth saying, this is not just terrible for infants. It's also pretty bad for the moms who have it. And it can be a symptomless infection. Is that right? What should a woman know just about her own health if she is either pregnant or not pregnant and may have syphilis?
Absolutely. So it comes in different stages. And the first stage is most often missed. The first stage can just be a simple, solitary sore that comes, stays for a while, and then goes away. And that could be, and that's primary syphilis. And then when you have secondary, then you see more systemic manifestations. You may see the rash that Dr. Rathore was talking about. But like he said, it's a great mimicker. You can see multiple other things that you wouldn't even associate with the fact, oh, I did have that sore, a few weeks ago or a few months ago or what have you. But by the time we get to tertiary, then that's when it is within the spinal cord system and spreading throughout the entire body. So it's again routine screening, even for non-pregnant women. We used to screen everyone with their Pap tests. We screened for gonorrhea, chlamydia, trichomonas, and then some years ago, insurance companies stopped paying for routine STI screening for women over 25. And when insurance stops paying for it, we don't find out until people start getting their bills. They start calling back and complaining to us, "Why did you screen me for this?" And we said, "Because we always did." Because women again are more likely to be asymptomatic of these STIs. And so over the years, I've noticed in my practice that women who used to come in and say, "I want to be screened for all the STIs," now know that they're going to have to pay for it out of pocket. It's not considered part of their routine adult health. Suddenly everyone trusts their partner. So no one needs to be screened anymore.
Yeah, one thing was going to mention is first of all don't want to you don't want to be the one diagnosing syphilis when they're symptomatic. That's very important. And
Explain what you mean by that.
well, when you're symptomatic, it's a little late.
Mhm.
If you have the tabes dorsalis, a CNS disease, or you have all those things, it's going to take a lot more to treat you. So you want to treat it as early on. So, and the only way, and I say this all the time, the only way to do is to get tested. If you're asymptomatic, get tested for syphilis. The other point, very very important, uh, if you have any STI, so if you have GC, you need to be tested for other STIs, including syphilis and HIV. Or if you have syphilis or HIV, you need to test for other STIs. So that's another time if you as a woman are tested positive for chlamydia, you need to get tested for other things also, because that's how you find it. But again, as I said, routine testing for non-pregnant women also is important. Two other points are important. One, condoms help. They're not infallible, but they help. Now, remember, we say that I use this number loosely. The condom failure for pregnancy is 10%. That's only for half a month. STI is every day of the week, every day of the month. So it's risk is a little bit higher than getting pregnant, but it still is better to use a condom than not to use a condom. So don't misunderstand me. So I think that's very important. Getting your partner test is very important. Here's the other thing. Sometimes the women will come and say, "Oh, I only have one partner." Yeah, but do you know your partner has only one partner?
Mm.
I think this is some things that we need to think about. So, it's wonderful you're monogamous, but we still want you to get tested.
I want to ask you just briefly something you call anecdata about individual cases and what they might show us, because you had a case in your area about a woman who was ultimately had her children taken because there were these broken bones. This infant was experiencing multiple broken bones, and the initial suspicion, perhaps with good reason, was that she was abusing the child, and it wasn't. It was a child who had contracted congenital syphilis.
How sad is that?
Mm.
On many levels. We fail the mother, we fail the child. It's a broken system that allowed that to happen. This mother mother was homeless, a high risk situation. The CDC and the health department recommend testing late in pregnancy. This woman was not tested late in pregnancy. Excuse me. So I think then she didn't she got treatment early on, but then wasn't tested late. I can't remember. Maybe she wasn't pregnant, positive early on, but I can't remember exactly. The point is that if the woman was tested late in pregnancy and was found to be positive, we would have treated the woman and we would have treated the child, and this would have never happened. These late infections are heartbreaking, not only because the suffering the child had to go through with many broken bones, but the suffering and the mental anguish the mother had to go, who was telling us and that, I didn't do any of that. But as healthcare providers, if you see multiple broken bones and we don't have another reason, we have to do what we have to do.
Well, Dr. Mobeen Rathore, Dr. Chandra Adams, thank you so much for being here. It was a pleasure talking to you. Appreciate it.
Thank you.
Thank you.
All right. Up next, two local theater powerhouses team up on a Sondheim classic. Welcome back. It's a Broadway classic with a staging complete with a 26-piece symphony and a 30-member chorus. Here to tell us more, we are thrilled to be joined by Katie Huffman, Tony Award-winning Best Actress and star of the production. A funny thing happened on the way to the forum. Thank you, Katie, for being here. Welcome.
Thank you so much for having us.
It's a thrill to have you. We are also joined by the production's director, Jean Tate. Good morning, Jean.
Good morning.
Numa Saisalin, president of the Florida Theater. Good morning, Numa. And we're also joined by Sarah Boone, executive director of Theater Jacksonville. Good morning, Sarah.
Good morning.
Welcome back. So I'm going to start with you, Katie, because you have an enormous role in this this production, and you also have kind of an interesting link with the originator of the role, Zero Mostel.
I do.
Because you've had some kind of cross connections in another role that you played
Yes,
in the producers.
exactly. And with Nathan Lane as well, who did the, what do you call that? Revival.
Extraordinary popular revival of the producers.
Yes. And no, I'm talking about the funny thing happened.
Oh, okay.
Nathan starred in that. Yeah.
Wow.
So
All right.
he's done a lot of Zero's roles.
Yes.
And now finally they're realizing that I have so much in common with Zero Mostel and Nathan Lane. Thank goodness. Finally. Truly, on the inside, that's who I am.
On the inside.
Yeah.
Yeah.
I'm totally on the inside.
This must be a really fun role to inhabit. I mean, you are a woman playing a role that is traditionally gone to a man.
But Whoopi played it on Broadway.
Okay.
Yeah, and she was terrific. I saw Whoopi. And it's certainly, this needs to happen more often, that women get to play the good, juicy roles. Because very often we're put into smaller, more stereotypical roles where the men get a chance to be funnier and, more fleshed out. And that's definitely this role. It's very fun. This is a character that really, really drives the action.
Yeah.
He's not, or she's not. I still call him he. That's fine with me. My family's gender's a little all over the place anyway. But he really is not the vaudevillian. He's really the guy who tells the story and gets things moving and provides for everyone else to be super funny. And he's super funny.
For people,
I'll
for
get
people who
there.
haven't seen, and there probably are a few out there who haven't seen A Funny Thing Happened on the Way to the Forum, this is a character of a slave that is trying to win his/her freedom by
Yes.
helping his owner connect with his love interest.
Yes, his love interest, who is a courtesan.
Okay.
Yes.
And it's complicated.
It's complicated because they're not the brightest kids,
Okay.
and, I have some wild ideas,
Mhm.
and it's ancient Rome. So who knows who's in charge? Somebody immediately calls for martial law, and then we're all under martial law. It just sort of happens. There are these powerful characters and these not powerful characters. And interestingly for me, this is a slave who drives the action. It's reminiscent to me of another Zero role, which is Fiddler on the Roof, where why is everybody listening to this milkman?
Uh-huh.
It's like their wisdom comes often from the fool, right? Or the one you're not expecting. So he has a lot of power. I keep calling him he. My
Yeah.
goodness. You can
Not
see where I
anymore.
am. But, I tell you, on the inside. But yeah, the power from a relatively low community member to have that power is really fascinating. That people listen to this slave is fascinating to me. But they're often the ones who have all of the information, because they're the fly on the wall. They're the one nobody notices
Yeah.
in the room. So people say things around
Uh-huh.
him, her.
So
Getting better.
people know you from a variety of places. You have been on Law and Order, Mad About You. You starred in the Nanny Diaries on Broadway. You were in the original La Cage aux Folles. You served as a judge on Iron Chef for
10
decade?
seasons. Yeah.
10 seasons. I guess
Yeah,
it's not
10
the same.
seasons.
It's like dog years, but
Yeah.
and also Curb Your Enthusiasm, which is we're all a big fan of. So in this role, you are doing kind of more like community theater. Talk a little bit about your connection to community theater as just a resource, as a place for people to discover, the
Yeah.
arts.
As far as I'm concerned, everything starts locally. Everything that's written starts locally. Wherever you are, every writer is a local writer. Every creator is a local creator. And I grew up, since this age of 6 doing community theater and learning so much in that environment, which was fantastic. Very fruitful childhood in that way, chaotic in other ways, but but there it was. There was my respite was community theater and ballet and opera and all these other things. But getting a chance to go into these communities, which I do from time to time, and see the people who really love doing this. I kind of get stuck in show business where you're trying to work and you're trying to find the next thing and how do I keep this way and that way, which I has never interested me. I'm interested in the people who want to do the work. And as I was talking to somebody the other night, like I may create the role, but somebody here gets to do it. And not just that role, they get to do all of the roles. These are actors who just get the chance to do everything that's out there. Whereas when you're a professional, you don't really get a chance to do everything. You're always looking for, what do I do next? But yeah, so I love coming into these communities. And this one particularly is full of wonderful actors, for one thing, but just sweet people. People who are excited that I've done something.
Yeah.
I was like, really? Okay, sure. Yeah. What do you want to know? But it's thrilling.
Yeah. Newest Lynn, I want to ask you, this is the second time that Florida Theater and Theater Jacksonville have partnered on this in-concert production style. For people who maybe didn't see last year's production of MAME or just aren't familiar with the concept, remind us what the conceit is. I mean, what are you bringing together?
It's like a radio. It's like a radio play presentation of a Broadway show. Everything happens on stage. So the orchestra is up on the stage. The chorus is seated behind them. The actors are all down front of the orchestra, and there's minimal staging because that's a lot of people to put on the stage.
Crowded.
But we perform, or I don't perform. They perform the entire show, start to finish. Some folks are still on book, some are not because it was a very short rehearsal period. But the idea is that it's a different way of presenting a Broadway musical. And Sarah and I talked about this for years before first producing MAME last year and now Forum this year, not being done in Jacksonville. So we're lucky in Jacksonville to have a great Broadway series in the Artist Series and a wonderful community dinner theater in the Alhambra. But nobody was doing this on a stage the size of the Florida Theater. So it was a way that we could add a little something to our cultural inventory.
And this is an opportunity, as Katie said, Sarah, for people in the community to participate in kind of this really exceptional level. You're also bringing back some talent to Jacksonville that's from here. Can you talk a little bit about how the community is involved? And also, I mean, you are also involved, right? You
Right,
are,
yes.
the head of Theater Jacksonville, but you also have a significant role in the production.
I do. And, this is an opportunity for everybody in town we have open auditions. So I think we did it back in either February or March, and we were able to fill all the roles. And the show this year is a little different than MAME because there are a lot of principal characters in this more than MAME because we brought in people last year. And so people are getting a chance to do bigger roles this year. And it's very exciting. So this is an opportunity for them to, again, go to the Florida Theater, which is so beautiful. It is such a treasure to our community, as is Theater Jacksonville over in San Marco. But it's a bigger venue, and it's an exciting thing. And to be able to work with professionals, people were so excited to hear that Katie was coming. When we had not announced Katie when we had auditions, and then afterwards they realized who they were going to get to work with. And then Jean Tate's coming back to direct, and she has a long history with us. So it's a combination of local people. Joey Chansey's coming in to conduct it. He grew up in Jacksonville, and he's a conductor in New York now. So it's a combination effort. It's a one-time-a-year thing, and it's very special.
Jean Tate, I want to ask you, this is, a big production. It's a Sondheim classic. And so there is a lot of bigness to it. How do you help, bring people in on a level where they can connect? How are you working with local crews to sort of tell this larger story? And I mean, just how do you kind of keep it all together? I feel like you're running a lot of cats there.
I'm running around in a lot of circles. But that's the beauty of the concept of a concert version is you don't have all the staging. You don't have people running all over the set, and because there is no set, it's just chairs and music stands, and trying to make comedy work like this that is so fast paced and very usually done very slapsticky.
Yeah, yeah.
There's a lot of door slamming and in and out of buildings, and we're trying to make it work with just bodies,
Yeah.
and it's really a fun challenge. And we did our first run through last night, and everybody was just cracking up because it was so funny. And I was like, "See, we don't need the sets, we don't need the costumes. This is great, just with really good, smart, funny, talented people."
And Numa kind of alluded to the short runway. So you cast it in March, but practically speaking, how much time have you got to run through it?
Basically 8-9 days.
Okay,
Yeah,
that's pretty
yeah,
fast.
yeah.
I mean, we should say it.
And the chorus
it-
has been rehearsing
Right.
Okay.
for since they were cast. I mean, they've had a number of rehearsals. So
And the symphony probably independently doing its own.
Well, they're coming in. When do we get them? On Thursday.
Thursday.
And they're from
Oh,
all
wow.
over the state. These
Okay.
players. Yeah.
Yeah.
So
Oh,
that's
Oh, that's
the last,
exciting because
that's the
you
last
open
edition.
Saturday.
Yeah.
Yeah.
Okay.
Whoa.
Gotta love that extra drama. This is, I think a big undertaking, but I'm sure it's going to be a lot of fun. Katie, how has it been so far? Just kind of like even with the run throughs and working with the local team.
Yeah, super fun. And these women and the leaders of this community here are fantastic. Yeah, it's been seamless for me. I'm not going to get to see much of Jacksonville while I'm here because I will be in the theater the whole time. But I saw the river today.
Okay,
Saw
they
that.
let you see that.
Yep. I was let out. I was let out for a minute. But yeah, I'm finding it thrilling, and I always do. I've been in this business now professionally for 42 years. So if you think I have something to give you, I'm happy to hand it over. Please ask me. Please involve me. And I loved, to see a young actor when I say, "Hey, our relationship is we're connected, we're family. I'm this to you," and he goes, "Oh." Like I'm allowed to do that, particularly with maybe a professional. I'm
Right.
allowed to do that. Yes, they call it a play for a reason because we get to play
Oh.
out there, and hopefully you just get a really good back and forth.
Well, Katie Huffman, it is great to meet you. The show begins Saturday at 7:30 at the Florida Theater. There is also a 2:00 performance on Sunday. You can get more information at floridatheater.com or the box office. Katie Huffman, Jean Tate, Numa Saisalin, Sarah Boone. Break a Leg, thank you so much for coming here today.
Thank you
Thank
so
you.
much.
Appreciate it.
All
Thank
right.
you.
And up next, we meet Jacksonville's own genre-bending retro Afro-futurist cellist.
The Florida Theater presents The Psychology of Cults, a live event exploring how cults form, why people join, and what it takes to leave. Wednesday, October 8th at 8 p.m. Information at floridatheater.com. Museum of Science and History's new exhibition, Mosh Archives, The Story of Us and You, steps you into a treasure trove of memories, now through August 31st. Tickets and information at themosh.org.
Florida's orange production is at its lowest point in more than a century. An industry critical to the Sunshine State's economy and culture is in crisis.
Literally, we may have 10 years left of citrus.
I'm Amory Sievertson. What's behind Florida's citrus decline? And is there any way to stop it? That's on the next On Point.
Today at 11 on WJCT News 89.9.
President Trump gave Vladimir Putin what he wanted in Alaska. Now Ukrainian President Volodymyr Zelensky is back for more talks. His last visit to the White House was disastrous. This time, he's bringing key European leaders with him to meet President Trump. The twisted path to peace in Ukraine, next time on 1A.
Today, starting at 10 on WJCT News 89.9.
Welcome back. Well, she is Jacksonville raised, Berkeley trained, but with a sound entirely of her own making. Here to tell us about the release of her new album is cellist and producer Nikayla Byratt. Good morning, Nikayla.
Good morning. How are you?
I'm great. I'm very glad to have you here. Very excited to talk to you about your current project. It is called Nikayla and the Funk. Tell us a little bit about the sound and the style.
Awesome. So the sound is based on a lot of like electronic funk, soul, R&B, probably from like the late 70s to like the early 90s. That's like my favorite era of music. And I just really wanted to put something out that sounded like that again because I feel like it was the sound that a lot of people miss, but they love so much.
Yeah, and that's music that you love and have been influenced by. But we should say that your training is you're a classically trained cellist. You
Yes.
started, you were telling me, as a violinist at a very young age. So tell us how, first of all, about your training, how you got into music in the first place, and then kind of how you ended up eh, capturing a sound that's sort of different than classical music.
Yeah, for sure. So when I was younger, I attended the art schools here. So I went through Pine Forest and then La Villa, then Douglas Anderson.
Mhm.
But in Pine Forest, around the third grade year, they let us choose like a major. And I saw the orchestra play and I was like, I want to play the violin. So that's kind of where I started. And then I auditioned for La Villa. And while I was there at the end of my seventh grade year, the director asked me to switch to cello. And I just kind of switched and just kept it on from then. And then all of the other instruments that I play, I just kind of taught myself along the way.
And after you graduated from Douglas Anderson, which was the third art school that you attended here, you went
Mhm.
to the Berklee College
Berklee
of
College of
Music
Music.
and got a degree there. And so now you're back in Jacksonville.
Mhm.
How does the cello translate to the kind of music that you're working on this new project, which, as you say, is like R&B, soul, funk?
Yeah. So that's like one of my main missions, like showing people that the string instruments are more than just like classical. Um, I just always love like older music. I always love funk, soul, R&B. I just grew up listening to a lot of that stuff. And I was like, you know what? Why not just do it? Why not just incorporate it and just try to see what comes out of it?
Okay. I want to, if we can, just take a quick listen to part of your new release that is called Tequila and the Funk. Let's take just a quick listen, then we can talk about it.
Baby, come close. Moving coast to coast. This motion got me feeling this way. So let's try. I feel like I'm dreaming.
All right. Well, that is a song off the new album, brand new album. It's called Come Close. And it is, a smooth ride. You have a lot of different sounds in the music that you do. What is it that you're trying to bring to the audience?
So I'm trying to bring back, well, I love drum machines, one. I love how futuristic they sound. I'm trying to bring back that electronic funk, that smooth R&B, like when you listen to the Isley Brothers or you listen to Marvin Gaye or Atlantic Starr, like groups like that. That's the kind of sound I'm bringing back.
Yeah. And you do basically everything. You arranged this, you composed the music, you wrote it, you sing
Mhm.
it, you play and program all of the instruments except for
The live drums.
yeah.
Live drums, I have Funkmaster Way. He was also here in Jacksonville. Shout out to him. He did such an amazing job on 3 of my tracks, actually.
Uh-huh. And you have been
Yeah.
playing with some extraordinary people and backing up some extraordinary people, including work with Jill Scott, Erica Badu. I mean, you've performed alongside them. What is it that, that experience has taught you about the work that you're doing?
So I haven't performed with Jill Scott or Erykah Badu, but I have performed with Layla Hathaway
And
and
Alan
Alan
Stone.
Stone.
Okay, I thought this was an
Yeah.
ensemble work that you did at Berkeley.
So that was an ensemble that they had at Berkeley.
Okay.
It was the Jill Scott and Erykah Badu ensemble, and I did that with Dr. Chelsea Green while I was there. And it was mostly like string instruments with other like traditional style like instruments like bass, guitar, stuff like that.
Gotcha. Thank you
Yeah.
for clarifying that. Okay. So we have a link to your new work on our website. People can find it there, but they can also look it up at nikaylathefunk.com. Nikayla, great work. It's so nice to meet you. Thanks so much for coming on today.
Great to meet you as well. Thank you so much.
All right. And that's our program. Thank you for listening. If you have comments or questions, you can send either to First Coast Connect at WJCT.org. And if you missed anything, you can catch our rebroadcast tonight at 8 o'clock, or you can find our entire archive on Apple Podcasts, Spotify, or wherever you get your podcasts. The executive producer of First Coast Connect is David Luckin. Our show's produced by Stacey Bennett and directed by Brady Corum, and our music is performed by Club de Belugas, except today when it's performed by Nikayla. Join us tomorrow. We're going to be talking to school district pedestrian safety advocates after 3 students are hit by cars in 3 days. I'm Ann Schindler. You've been listening to First Coast Connect on WJCT News 89.9.
When I see you, and I know that you don't know me well, but I want to. So baby, come close, moving coast to coast. This motion got me feeling this way. So let's try.
Support for First Coast Connect is provided by Baptist Health and the North Florida TPO.
Baptist Health is a proud supporter of First Coast Connect. Baptist Health, committed to building a healthier community for all of us. More info at 202-4YOU or baptistjacks.com. The North Florida TPO is dedicated to transportation planning, funding, clean fuels, and new technologies for a vibrant, resilient, and connected region. More information available at northfloridatpo.com. Museum of Science and History's new exhibition, Mosh Archives, The Story of Us and You, steps you into a treasure trove of memories, now through August 31st. Tickets and information at themosh.org.